We're the Mississippi Nurses Association. We are the voice for the Mississippi nurses and for healthcare of Mississippi. We are the people that are the group that speaks to the legislature, to other interested parties in what happens to nursing and healthcare, and to be the voice for them across the state. Today we're going to educate nursing students and nurses about the issues that are at the legislature now and the issues that will affect us in the future, as well as to give a little insight to the legislatures about what nurses can bring to the issues at hand and our voting power.
What are some of the issues facing nurses in Mississippi right now?
The primary issues, I guess, would have to do with the Affordable Care Act and possibly the insurance exchange and how that's going to affect the citizens of Mississippi and increase the access to care, which will also impact nursing and their availability and whether they'll be able to give that care.
The legislative process essentially dictates policy throughout the state as well as the nation. So nurses have to be at the table during that process in order to effect changes that are necessary both from a professional standpoint as well as access to care, quality of care. So essentially it's looking at this from the patient's aspect as well as the nursing profession.
There are a lot of nurses and they're in every setting, and we need especially to continue properly funding the schools of nursing. We need to continue pushing to let these nurses go out into rural Mississippi and provide health care to the people of this state. And those are our two major issues. We're there for the patients, and we just need to be allowed to do what the nurses are capable of doing.
How important is that to the people of Mississippi?
Well, it's extremely important because currently there are not enough physicians in the state, especially in the rural parts of the state. But we have advanced practice nurses who can provide primary care and who will go out into those sections. We have got to make sure that all barriers are removed so that they can go out and take care of people. I submit to you that there are approximately 3,000 of the 50,000, there are 3,000 advanced practice nurse practitioners, midwives who are capable of providing primary care all over the state. And so nationally, 18 states have expanded their role. And more states are going to do that because we've got so many more people coming into our healthcare system. The baby boomers, the Affordable Care Act. And whether you are for or against the Affordable Care Act, it is the law of the land, and we are going to see more and more uninsured coming into the system, and we've got to have somebody out there to take care of those people, and the nurses are there for that.
I am a family practice nurse practitioner and a wound care specialist, and I want to welcome you today to the 2013 Statewide Nursing Summit. It's hard to believe that this is the 19th time that we have gathered nurses and nursing students. We're gathering to learn more about the legislative process, the many changes that are taking place in the nursing profession, and how the ever-changing landscape of healthcare impacts us as nurses. I want to thank you so much for attending, and thanks for the many volunteers of the healthcare who have worked to make this day possible. There are so many changes taking place today, and many on the horizon that will impact our practice and the patients that we serve. I want to encourage you to learn from many of the presenters here, not just the educators in your classroom, not just from the people on this podium and your directors and your officers for M&A. There are leaders in every area in this state in nursing that have changed the way we nurse today and how the law regulates that practice. It is our responsibility, it is our passion to be involved in that in whatever way we personally can. Today we're going to be so fortunate to have our keynote speaker, Dr. Linda Burns Bolton, a nationally recognized leader in nursing.
My message here today is about how nursing can help the nation to transform its healthcare delivery system. And through some work that I participated in with Dr. Donna Shalala, we led a committee from the Institute of Medicine on the future of nursing. And so I'm here today to talk about how that relates to what the Mississippians are doing to be able to improve the health care in their state.
What is the future of nursing in the United States now with the Affordable Care Act, and specifically here in Mississippi?
Well, the great news about the Affordable Care Act is it provides multiple opportunities for nurses to lead. And so today I'm going to be speaking about those opportunities to lead. And here in the state of Mississippi, it is one of the states that has an action coalition. That action coalition is actively working to try to engage nurses, physicians, and consumers about how they can improve health in their own state.
Tell us about the vital role that nurses play.
Nurses play a vital role in many different arenas. Everyone thinks about a nurse as in a hospital. That's the average consumer believes that that's where nurses work. And that's true. They work in hospitals, but in different roles in hospitals. We have nurses who are in legislature. We have nurses who are governors. We have nurses who are United States senators. But we have nurses who do all kinds of things. The one thing that nurses bring to the table, no matter what the job is they are in the business of human caring. And when you have someone who cares about human, they're going to advocate for what's best for all humans. And so the role of nurses is not limited to just the delivery of care at the bedside. It's everywhere from birth to death, you will find a nurse.
I like to be involved in a lot of things, and one of the things I really like to be involved in is what I felt was my calling, and that was healthcare. To become a nurse, and then further that through some advanced practice nursing, I felt was what God had led me to do. And I have been very fortunate that I've been able to serve a lot of people through the 12 years of being in private practice, 3 years before that with a local group, and then nursing before that. I was able to spend some time down in New Orleans at Charity Hospital before I began my advanced practice degree, and got to see some very unique things there. Got to see how people of different cultures work together and how things are celebrated there. And I want to bring some of those ideas back to Hattiesburg, back to Mississippi, back to where I call home, where Amy Jo and I started our family. And so today I'm going to talk with you a little bit about how we don't just go into the hospital and provide care and go home and turn it all off. How that each and every day we have the opportunity to influence individuals, whether you're at church or you're at the soccer fields. I have 4 kids, we're at the soccer field a lot. But I want to talk to you a little bit about how we make that, take advantage of those opportunities that are before us. The message is that we can all have influence in our everyday lives, and that influence can be a positive one or a negative one. What we want to do is make sure that as nurses, as healthcare providers, we're utilizing each and every opportunity to make that lasting impression, whether it's with patients, family members, priests, at every opportunity, making sure that we're contributing something to the conversation. Tell the wonderful story that nurses have to tell.
What value do nurses offer, particularly in the rural areas of Mississippi?
Sure. Well, in each and every area, especially the rural areas, nurses serve sometimes as the first primary caregiver for individuals. That might be an aunt who has something going on and she just wants to call you on the phone because she knows my niece is a nurse and what do I need to do about this? Well, sometimes you need to call 911. But people in the rural Mississippi areas and throughout the South really look at nurses as one of the again, primary caregivers, one of those first steps at trying to seek care. And they can do that in a clinic, they can do that in a school, they can do that at church.
Here are some of the things that the legislature deals with. Annual funding for nursing education. Every AD program, every baccalaureate program, every master's program, every doctoral program has got to get funding from the legislature. That's where it all starts. So if any of you are in education, it's really important that we keep up with what's going on down at the legislature. Scholarships for nursing. I'm sure that's not as good as it used to be, but you know, they just did an emergency contingency funding bill a week ago down at the Capitol to put some $2 million more into scholarships, and I'm not sure where that went, but you know, scholarship money comes through the legislature. Scope of practice issues. I mean, right now, down at the legislature, there's a bill opening up the Nurse Practice Act, and it is this thick. That's how many changes are in it. And so how many of you have read that bill? Show me your hands. Well, this is your Practice Act. Somebody needs to be looking at it. So know that it's open and everybody down there is having a chance to get into your business. And it's very important that you keep up with that. And so what I tell the legislators, and by the way, they are not listening to us now. Are you listening to me? We're not having the ears down at the legislature that we once had. And how many of you in here are Republicans? Bare your soul. Mm-hmm. Listen to me. The Republicans have taken over. Medicine has their ear, and you do not have it. So you people who are Republicans in here are going to have to come to the fore. You're going to have to be the ones that are to go down there and get their attention. So if you're a Republican, you need to sign up today for the M&A Health Affairs Committee, and you need to get very, very active. Okay? So that's my charge to you. So that's how we ended up with the expansion of the nurse practitioner programs. Here's the message to the legislature. There are 2,700 physicians who are qualified to be collaborating physicians. And they're in 4 categories: peds, family, and watch my brain fail me here, internal medicine, and OBGYN. Of those 2,700, now they've got to collaborate with about, if you take the CRNAs out of the 3,000, which is about 600, that's how many nurse practitioners we've got to find a collaborating physician for. Now, they're all big, pumping their chest down there. We've started the Rural Physicians Program over at UMC, and they're pumping $3 million into that this year. $3 million. And they're all proud of that. And I'm not saying that we don't need docs. We desperately need more physicians. So we're all for that. However, if you can put out 125 nurse practitioners for a whole lot less money than that, and you can I think you can put 15 docs out for that, but you can put 150 nurse practitioners for even less than what you're going to pay for the docs. Where's your brain, Republicans? If you're into saving money, you're into doing all this. So you people who are Republicans need to be telling them this. Okay, but here's the dilemma. Here's the dilemma. We've got 2,700 docs that are eligible to collaborate. The law says you got to collaborate. So if there's a hospital up in North Mississippi that hires part of those doctors, and they say, well, you can't collaborate with a nurse practitioner unless that nurse practitioner works in this hospital, so that takes a bunch out, right? And then you've got some who just don't want to collaborate. And then you've got the Board of Medicine breathing down their necks. There's simply not enough physicians with whom they can collaborate. So that's going to affect healthcare in Mississippi. So I tell you all that so you're the people who, you're at the forefront, and you are going to have to send that message to your legislator, because they're listening to medicine and not you.
There's some real significant changes happening, Nurses are losing, their salaries are being cut, and their job positions are people are getting laid off. Nurses, can you imagine that? It's unbelievable. We don't want to cut our nurses. We want our nurses to be in full force, providing the best care that we can. And the only way we can have that voice is through Miss Betty and Teresa, standing up there and helping us to become a voice for Mississippi. That's really what I wanted to tell you, is that I appreciate them, and I appreciate those that have called in for the teleconference that we have on Fridays. That is so important. And at one point we had like 25. We had about 15 on the teleconference, and then we had 10 at the round table. And we discussed every House bill and every Senate bill. And we decided if we should monitor it or support it or oppose it. But we're looking at these bills. We're considering what the facts are and where we need to have a stance on that. So we need your voice as a nurse to tell us, that's not a very good idea. No, we don't want that.
Get involved.
at whatever level, with whatever time that you have, in whatever manner you can. You have to get involved. When I came to the Nursing Association, someone asked me, well, you know, why the Nursing Association? And I said, well, if you look at what's going on right now in healthcare, to me, there's almost a perfect storm. And, you know, perfect storms don't come along very often. But if you look at the baby boomers, the aging population, chronic illnesses, what's going on with healthcare reform, you can just name all of these things, and in every single one of those issues, nursing comes up. Nursing needs to be at the table. Nursing is the way that many insurance companies, that many companies are looking at using as educators, as using as outreach. The nursing profession itself is just lining up to be such a movement throughout this country. And we need to realize that you don't get those opportunities very often, and we need to take advantage of those. And we do that, again, by supporting your professional organization and by supporting those elected officials that support us. So again, at the end of the day, become involved.
We are gathering today students as well as the nurses in Mississippi to really learn more about how the legislative process works and really how important it is that nurses are continuously involved in that process, because it impacts health care and it also impacts the patients that the nurses serve.
As we progress forward during this legislative session, we'll be working with your leadership on the various issues that are important to each of you collectively as well as a group, collectively as well as individuals. And we're going to focus on what we think is most important. And as I travel all around 2011, what I found was people all across Mississippi are talking about what they believe is most important, and that is job creation, bringing better and higher paying jobs to Mississippi. I have a political philosophy which says government does not create jobs. Government simply creates an environment which encourages the private sector to invest capital and create jobs. But I'm also a conservative that believes intrinsic within our job creation efforts, we must improve the educational attainment level of our citizens. And so as you look at the newspaper or hear from your leaders about the things that we're focused on in the capital city and in the state capitol, we're focused on job creation by improving our workforce, and we're also focused on looking to find ways to improve that environment so that we can encourage people from around the country to invest capital here, but also to take those small businesses throughout Mississippi and encourage them to invest more of their money and create more jobs here. Because one thing we know for sure is that a growing economy is good for all of us. It's good for our healthcare industry. It's good for our education entities, and it's good for the state budget, which is certainly very important to me. But it makes for a better place for us to raise our families. With that, I'll conclude again by thanking you for the invitation. I see you have some tremendous members of the House of Representatives here, as well as Senator Burton and Senator Jolly, two leaders in the state capitol, particularly on healthcare matters. So again, thank you all for giving me the opportunity to speak. I think that we've got to continue to work with our providers, physicians, nurse practices, nurses as well, to continue to increase the quality and the availability of care in Mississippi. If you look at the number of providers in our state, what you find is that while the numbers are not good, they're not that bad, except for the fact that so many of them reside in the Jackson metropolitan area or on the Mississippi Gulf Coast, and so as you go to more rural areas, there's not enough providers out there.
We are Mississippi nurses, and we have a voice, and we want to be represented in a positive light, and we want to take care of patients, and we want to do a good job. We want to do what's right to help take care of Mississippi and to help promote nursing so that we don't lose nurses. We've got to have nurses to take care of patients in Mississippi. We've got to do a good job. We've had declines in nursing students before. So we want to keep that up. We want to keep our nurses empowered, and we want to keep them in a positive light and encourage that because their changes, stick with us. Things are going in the right direction, and we're here to serve the nurses and have a voice for them in legislation.
A nurse practitioner is an RN who already has her bachelor's, who's gone back to school and now has a master's degree in a program that usually lasts up to 2 years, including a lot of clinical time. And that nurse practitioner can be prepared in a number of arenas: family, pediatric, psychiatric, and many more that I'm not naming right now, geriatric, etc. Those nurses are capable of assessing, diagnosing, developing a treatment plan, and actually treating a patient that's within their scope of practice. If the nurse practitioner finds that the problem is bigger than his or her scope of practice, then they go ahead and they refer it on to their collaborating physician. So that's what a nurse practitioner is in this state.
Nurse practitioners are vital to a healthcare delivery system, and here in the state of Mississippi, they are providing primary care to the citizens of the state of Mississippi. Primary care is that care that is needed to be able to identify what's going wrong, how to fix it, and how to stay well. And it's important because Mississippi is mostly a rural state. It's important that we have individuals who are willing to work in all parts of Mississippi, not just in the capital, but in the rural parts of Mississippi, in the back roads, and who will bring care to the citizens of the state of Mississippi wherever they live, work, or play.
What kind of a role can nurse practitioners play in a world with fewer doctors?
Nurses are a part of the interprofessional team, so they are working with physicians to be able to provide care. They're helping to design the healthcare delivery system, to deliver the care, and to evaluate what's working and what is not working. So they are partners with physicians. It's not an instead of role. It is a collaborative practice to be able to assure that the citizens in this state have access to health care.
What will the expansion of Medicaid mean for nurses?
The expansion of Medicaid means we're going to need more nurses in community settings. I use the term where people live, work, and play because that's where we need nurses to be, not just in our hospitals. And so we need more nurse practitioners to be able to provide the care that is going to be now affordable for those who don't have access to care. We will not be successful in caring for 33 million more individuals without nurse practitioners, without staff nurses, without school nurses, without nurses in all kinds of venues.
Nurses are on the front line for patients. We're there and we're their voice many times, and they look to us as advocates to help them when they have questions. You know, medical field is very intimidating sometimes, you know, especially when you get a diagnosis that you don't understand. Cancer, you know, that can be so intimidating and frightening. You don't know where to go, your next step. So oftentimes, if you have a friend that's a nurse, they can come to you or you come to them, and you can help guide them along the process, say a prayer for them, and help them through those difficult, really difficult times in life, you know.
It is very important for nurses, RNs, LPNs, nurse practitioners, nurses with PhDs that are teaching, to become and remain very aware of the legislative process, because lots of the rules that come down have to do with health care of patients, safeguarding patients' health care, rules that impact or may impact on nurses, and things that may actually impede access to care in this state. So we need to stay awake and alert and become very active in the political arena.
I am encouraged by what I've heard and seen at the summit. I'm very happy to be here. The Mississippi Nurses Association is doing phenomenal work. The fact that you are able to gather not only the students, which are our future, but also the individuals who are currently working in the nursing field together to be able to say, we can do it. We can design the future of nursing in the state of Mississippi. We can make it happen.
Healthcare is going to be undergoing lots of changes in Mississippi over the next year or so. What role will nurses play in those changes?
They are a very vital part of the team. They are the backbone. They give personal hands-on care, the human care touch, as well as coordinating care across the span of the illness. They start with the babies all the way to death, giving the individual care that each person needs in a holistic manner.
Let's keep in mind that nurses are humans and that we are here to serve the public, and that nurses as a whole, we love our job. We love taking care of people, and we want to do a good job, and we want to serve our community and take care of our people. You know, the people of Mississippi are family. So we take pride in that, and as I was taught, treat your patient as though it's your own family member. And so that's what I try and do.
Mississippi, RNs and nursing in general are a vital part of the team approach to giving health care, and that we speak for each other and for the health care of Mississippi, and that we are there to be an important voice for them.
We are so pleased at the number of nursing students that are in attendance. You know, they really are the future of nursing. So if we can encourage them to become involved at this point, then they're going to stay involved throughout their professional career. And that's really our goal here, is to educate them on how important it is that as nurses, that they stay involved through their student aspects as well as on into their professionalism.
If people have questions like more information, what should they do?
They should contact the Mississippi Nurses Association. We would love to talk to them. You can contact us at 601-898-0670, and you can also access information on our website, msnurses.org.